Hello, my name is Dr. Noman Alexander. I'm one of the senior urology registrar in King's College Hospital, London, in UK. Today, in this very short video, we are going to talk about FRCS in urology, how to gain eligibility, and what are the books and materials that you need to study for your preparation of Section 1. In this video, we will only focus on Section 1 and then we will make another video about section 2 later. As far as the utility of FRCS is concerned, you know whether you are an IMG or you are a local trainee in UK, you need to do FRCS for your both scissor and CCE pathways. Although people with international fellowships like CIBU or fellowships from India and Pakistan and also apply for CISA without doing an FRCS, but getting eligibility or getting a yes in terms of knowledge component of the eligibility for CISA will be very difficult without FRCS. So FRCS is pretty mandatory for CISA as well as for CCE. People in CCE who are in UK training normally appear in FRCS during their final year or during their SE 6 or 7 years, whereas as an IMG, previously MRCS was not mandatory for FRCS, but now Royal College has stated that MRCS is necessary for everybody who's appearing in FRCS, and also from next year, there will be no international FRCS because it was not proving useful for people who used to spend a lot of money and time on international FRCS only to know later that this will not be a required knowledge component for CISA. One thing that we need to keep in mind that people who did international FRCS, it is only for doing GMC. It will not be for scissor. For scissor, you have to do JCIE, FRCS, and JSFE or International FRCS will not be sufficient for you to do a scissor pathway. So the bottom line is that you have to do JCIE FRCS if you want to become a consultant in UK by CCE or scissor. So to do JCIE FRCS, you have to do MRCS. You should be working in UK for at least 3 to 4 years. That's what it normally takes. If you are really genius or you aim at a very higher level in UK, you may do it in 2 years as well. What basically is required for FRCS, you need basically 3 references from your consultants where you're working. One will be from the clinical lead of your working place. The other two will also be preferably from your working place senior consultants, or it can be from your past place, but it has to be recent. You basically need a reference form which are available on the website of RCS, basically where they mention your knowledge, skill, and attitude component, stating that you are good enough to be a day zero consultant in UK. It takes a lot of effort and for your bosses to sign you for your FRCS. When they think that you are good enough to be a consultant, they will sign you off. So you will need an MRCS, you will need um, 3 forms from your referees. You will need ISCP portfolio, where they will expect you to have level 3, level 4 WBAs sign off for all 6 or 7 major procedures and the 14 critical conditions that are given in your ISCP. They basically want to compare you for ST6 level. For that, you have to have substantive and good amount of WBAs in your ISCP to sign you off. They will also ask you for a CV where you can mention your experiences since your graduation, and you have to be 6 years from your MR or your MBBS and 4 years in urology. So these are the basic requirements of doing an FRCS. Uh, Eligibility: you should be an MRCS, you should be 6 years into after your graduation, you should be 4 years into urology, you should have 3 reference forms, you should be having enough WBAs in your ISCP portfolio, and a CV. And then you will get, after applying, you will need 2,000 pounds, which is the fees for session 1 and session 2. And then you will receive an email from Royal College based upon this evidence whether you are good enough to be an FRCS or not. If you are given eligibility, then you will have Section 1 exam. Section 1 exam is basically a written exam where you have paper 1 and paper 2 on the same day. Paper 1 will contain 120 MCQs which you have to do in 135 minutes, and then you will have 1 hour break where no lunch or food will be provided, and after 1 hour break you have again 120 MCQs in paper 2 and you have 135 minutes to do that. The passing marks are similarly calculated as in any other fellowship exam on percentile. Usually the passing marks are from 66% to 69% and sometimes 70% of the 240 MCQs that you will be having. You have to pass paper 1 and paper 2 individually, as well as your combined total should be of the required benchmark. As far as the books and materials that you need, a very important book is like in any other exam, you will divide your preparation into reading or revising your knowledge by textbooks, and then the remaining half you will spend on doing revision of questions and past papers. One thing that I want to mention that for FRCS, if you compare it to MRCS, officially you are not allowed to reproduce or share past papers of your FRCS. Be very careful that you don't share it on Facebook or social media platforms as we used to do in MRCS, because Royal College is very strict about sharing of their question pools, and it is not allowed. So going for the textbooks, a very important book is Essential Revision Notes by Jack Donetti. It has book 1 and book 2. It is recommended by Bowles as well on their website. Very important revision notes. I will recommend that you go through this book at least twice or 3 times. The total preparation time should be about 3 to 4 hours, 3 to 4 months, when with job obviously, and you need to take enough preparation time of at least 2 weeks of annual leaves before your session 1 exam. So Jack is a very important resource. The different Oxford Handbook of Urology is also very useful for your basic knowledge. I will not recommend studying Campbell Urology, Smith Urology, or EUA guidelines because they contain so much material that will be probably needed in Section 2. For Section 1, for textbooks, Jack Donati, Essential Notes, and Oxford Handbook are enough. For the second part of your exam, you need to practice past MCQs. Although I will not be able to share with you the MCQ books because of copyright issues, but I can share with you that the main important topics that are repeated in FRCS MCQs. And as you know, there are 8 sections of FRCS urology. One will be, 2 of them will be from uro-oncology. One will be benign prostate enlargement and embryology. 4th will be pediatric urology. 5th will be functional urology and urogyne. 6th will be emergency and trauma. 7th will be stones and UTIs. And imaging and technology will also be there. And neurology will be our benign prostate enlargement section. These are the 8 sections that you need to prepare as you will go through your preparations. The important topic that you have to study, first of all, there will be 2 sections from uro-oncology. Uro-oncology, one will contain kidney and bladder cancer, and uro-oncology 2 section will contain testicular, penile, and upper tract disease and prostate cancer. So for these, the most important topic will be TNM staging. There will be a lot of MCQs where they will be asking you about TNM staging. So make sure you prepare all the tables of TNM. They ask a lot of questions about different type of RCCs and their syndromes. ERTC for bladder cancer is also very important. They do ask you about stage-wise management of CASTs and their recurrence and their tumor markers. About CA prostate, they are very particular about the staging workup and recurrence in case of CA prostate and different mechanism of different drugs that we use in CA prostate. For bladder cancer, they will ask you about BCGs and different treatment options available for bladder cancer, including radical cystectomies. Basically neuro-oncology, they basically are the same stuff that you would have done in your fellowship, including the important stage-wise management of the disease and what will happen in recurrences. In pediatric neurology and prenatal hydronephrosis, uric aerosol, uric acid reflux, primary uric acid junction obstructions, MAT renograms, there are different types of curves. In imaging and technologies, they will ask you about radiation doses, prostate MRIs. They will show you a lot of pictures of CT scan and MRI of different topics where they want you to pick the findings and with the help of the scenario and finding you are able to answer. There will be a lot of questions on neurodynamic as well. There will be like 5 slides of neurodynamic where they will show you the places and you have to identify. So make sure there's a small book called about neurodynamic as well that you can buy from the Amazon or any other stores that is also very useful in studying neurodynamic or neurodynamic made easy. And they will also ask you about in andrology, priapism, parallels are very important. They will ask you in stones, they will ask you about type of stones, stones and pregnancy, different modality of stone treatments. In and other topics that are important are types of proctitis and radiation doses associated with different type of imagings. In functional neurology, different type of lesions and their effect on urinary tract. In slings, artificial urinary sphincters, as far as urinary incontinence is concerned, different type of urinary incontinence. Functional neurology and urogyne are very much represented in your paper, although in your clinical practice you don't see much of these, but this carries a significant portion of your exam as well. And apart from that, other topics are just very simple and very random. There will be a lot of questions that you will be able to answer based on your clinical practice, like IPSS, like quality of life index and ENM classification stuff. There will be questions that will be involving some critical thinking, and there will be images, there will be MRIs, there will be CT scans, and there will be neurodynamic traces. On the day of the exam, I will recommend that you object your computer-based exam on your computer screen if you, in the first hour, as for every paper you have 2 hours and 15 minutes, in the first hour you should be able to go through all the MCQs or at least 80 to 90 of them in one go. The MCQs that you don't know or it's not coming in your mind, you can flag for later or you can add to the review questions. What I did in the first hour, I quickly go through the questions that I was able to answer like very easily, and at the end of the 1 hour, I was already through the paper, and I answered about 60 to 70 of them, and all the others I flagged them and I booked them on real, and then in the remaining 1.5 hour or 1 hour 15 minutes, you can go through your flat questions. The most common reason of failure is obviously time management. If you don't finish the paper in time, or you're leaving too many questions to review later, that's a very common reason of failure. If you're not doing one and a half question per minute in the exam, that's also a reason of failure. Once you pass that exam, you don't need anything else for your Section 2 exam. Section 2 exam is pretty straightforward, and we will make another video about it. And once you pass that exam, you will not need any of the references for Part 2. They will automatically book your place for Section 2 whenever they have the slot. And as such, there is no eligibility for Section 2. The only eligibility for Section 2 is Section 1. If you have any questions regarding this, please mention in your comments, and I will be very happy to answer them.